welcome everybody to the City De Pere Board of Health meeting of November 10th. We're starting about 5:20 right now because of some technical issues, but glad we finally got ourselves going. So with that, we'll start the roll call. Pamela Gantz.
Here.
Devin Peacock.
Here.
Terry Gulas.
Here.
Robin Lawrenson.
Here.
Dennis Highbury is here. We also have Crystal Waller is here. Sarah Lawrenson.
Yep.
And Kelly Burke.
Here.
And in the audience, we have quite an esteemed audience here as well. Mayor James Boyd is here. Teresa Gorth is also here. And Chris Collada from the Division of Health is here as well. And that's all the public I see at this time, so it's a great way to start. So with that thing, can I make a motion to start the meeting?
A second.
Second, okay. All in favor, say aye.
Aye.
Okay, any opposed? Okay. Public comments. No public comments. We do have people in the public. Chris, are you here for a reason? Or Mayor Boyd, are you here for?
I am, but in a while.
In a while. Okay.
I'm here whenever Crystal tells me to.
Well, then I won't worry about the other members of the public here because we'll be all set then, so that we don't have any members of the public. Okay. Okay, approval of the August 11th, 2025 meeting minutes from the Board of Health.
I make a motion to approve.
Motion to approve. Second?
Second, Terry.
Okay, any discussion? Hearing none, all in favor say aye.
Aye.
Any opposed? Motion passes. Okay, now comes the next one, which is special meeting that we had on September 29th. I recall it being about 2.5 hours. And motion to approve the minutes of the
Make a motion to approve.
November 10th meeting, okay? Second?
November 29th.
I'll second.
Okay, second, Devin, okay. Any discussion? Hearing none. All in favor to accept the minutes as posted, say aye.
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 Opposed? Okay. I'm going to ask you a question. I guess I do have a question on that. Do we have to know what happened? Follow-up, did they?
Yes, they did notify us in the time frame that was required that they did relocate that dog.
The older dog?
Yep,
Okay,
the older dog.
great. Good, it was worth it then, wasn't it? I guess to a point. Okay. Special recognition of the Division of Health. I guess ongoing Board of Health member, chairperson. I guess that's me.
That is you.
Okay.
So everyone saw the memo that was attached to this Board of Health recognition agenda item, and you see here that Dennis has served 50 years in public health, 12 as the De Pere, as a member
Board
of
member.
the De Pere Board of Health, and then chair for how many years?
I think 6.
6. Okay. So just want to thank you, Dennis, for your time, your advocacy, and your commitment to public health in many different roles. You served as a sanitarian.
I did.
You served as a regional director. You served as a Board of Health member and Board of Health chair. So 50 years is a long time, and we just wanted to make tonight special. And thank you for your support always to our board and to our public health department. So we have Mayor here to give the first recognition. I'm turning it over to Mayor.
Oh, you are. Come on around. Come on around. Crystal, you can come around.
Okay.
Yeah, why wouldn't you? Good start to your last meeting, Dennis, with the technical glitches, huh? I'm sure this wasn't the way it was when you came here in 2013, so
All about you.
come on over, Dennis.
Over here from the De Pere
In front of the De Pere sign, yes. So we do have a nice plaque for you. But again, I had a chance to work with Dennis a couple of times. Obviously very professional, one of which was the hiring of this person right over here, which went quite well. 50 years in public health. That's incredible. It goes by quickly. One of the toughest parts of my job is to, encourage people to, serve for the various boards, committees, and commissions that we have. And we have nearly 70 residents, and have people like Dennis step up means a lot to not just myself, but all the residents that appear. Board of Health is a very important board that we have that affects a lot of people's lives for a lot of reasons. You helped us through the pandemic, back in 2020 through 23, and quite honestly, obviously, we know it probably still isn't done yet. I mean, this is very important stuff. So we couldn't be more grateful and extend our appreciation. And as part of the appreciation, we do have a plaque right here. Dennis Highbury, in recognition and appreciation of your service to our community, Board of Health, 2014 to 2025. And again, it pales in comparison. 50 years, Dennis. That's incredible. So on behalf of the city, we want to thank you. But before I give this to you, is there something you'd like to say? You can hold this right
I can hold this right here.
It's on video so people will see,
Well.
so the pressure's on.
Well, when I started 50 years ago in the Northeast region, that consisted of 17 counties. We had 30 health departments, 10 of those being city health departments, 17 of those being county health departments, and the rest tribal agencies. We've now down to 3 city health departments because the other ones have merged. But De Pere used to be a level 1 health department back at that time. And throughout the years with the health officers recently, it's gone from a level 1 to a level 2, which is a second portion, second recognition they could have. Then the top area being a level 3 health department. And it's been all the work of basically Crystal, the Board of Health, the city people, city employees, Debbie Armbruster, a variety of things like that. It's just been very, very great to watch the growth of De Pere and the support of the city of De Pere that they receive with the programs they have and the staff they have. So it's been an honor to work with Crystal, with all the staff, to see them progress throughout the years that I've been here. So it's been great. So thank you very much for that.
Excellent. Very well done. Crystal, anything you want to say? I know you said up there as well, too, but if you want to just close it off.
Yeah, just always in my first term, in my second term here, your support and advocacy for the City Health Department has been unwavering, and just your professionalism and always willing to pick up that phone and have a conversation. So appreciate your time always and your expertise in public health. And I know that even though you're retiring, you will continue to be an advocate for your for your local health department. I know that for sure. So thank you.
I mean, I can leave now.
No, here, hold that 1 second. I'm going to take this, shake your hand. I'm going to
Right,
give this
thank
to
you.
you.
Mayor, thank you very
You're
much.
very welcome, Dennis. Thank you. And thank you everyone back here as well, too. We will have a picture. It's going to be on video as well, so we'll get that to you.
Speaker now, just 1 second.
Oh.
Thank you. I'm gonna go on mute, okay?
And then Crystal, we'll have Crystal get here too as well.
Okay, there's our technical solution right there.
Yeah, just do it like that. Yep. Put that back on.
Okay.
That's okay, I'm taking a whole bunch. That way we can.
Better with the glass. Thank you.
Mayor, thank you very much.
Thank you.
It's been a pleasure working for the city. Yes.
I'm going to put this in the box and set it right next to you, okay?
Did you take a picture?
Dr. Shandell, we're recognizing Dennis right now.
What do you think?
Dennis, do you want to stay up here just because we have one more recognition?
Whoa.
This is, yes, let's take this again.
Get a water bottle.
So this recognition is from Paula Tran, and we have Chris Kulata here recognizing you from the state and the state health officer.
I don't think I know Chris.
So Dennis, I just want to congratulate you on a 50-year career. It's funny, we've only had 2 regional directors in the Northeast region. Dennis is the first, and you set the bar so high I can't retire for a while. So thanks a lot for that. But no, it's been just a privilege. It's amazing just to see your commitment to public health through 50 years. And so first with the state, now at a local level, Maybe I'll have to find a Board of Health to serve on eventually someday when I retire. But it's just one of those, we're not seeing people staying committed to 50 years. I mean, I've seen 40, I've seen different things, but 50 is amazing. So why don't you try for 51? No. So I'm done pushing, I'm done. So from the Wisconsin Department of Health Services, a leadership and dedication to public health certificate of recognition presented to Dennis Hybray for 50 years of dedicated service in state and local leadership, protecting the health of the public and promoting everyone living their best life, signed October 20th, 2025 by Paula Tran, the State Health Officer and Division of Public Health Administrator. So I'll give you, if you come on Thursday, I'd have her give it to you, but seeing it's your last Board of Health.
Thursday, no, I'm going to be done with that one.
Congratulations, Dennis.
I got to find places on my wall for all these things now. You realize that, don't you? Well, thank you very much. You know, Chris took over my job when I retired back in 2013. Yeah. So he's been doing a very good job, and it has changed a lot since that time. You know, 13 years, you think it's going to stay stable, but it really hasn't. It's always been something crazy going on. COVID being one of them, which I'm glad I didn't have to live through that one, I guess, but it was interesting.
We actually have a retirement. I'm going to take on 29 agencies starting in January.
You are. Northern region, right, Angela?
Part of the northern region, yes.
Well, that's fun. Best you, Chris. Well, I appreciate it very much. Thank you very much.
Thank you.
Thank you.
Thank you.
Very nice. This will be you in a few years.
Okay, and we have Dr. Shandell on the phone on mute. So if at any point we hear something through the mic, it is Dr. Shandell.
Well, where do we start?
What's next?
Yeah, what's next? Well, that was very nice. Thank you all very much. Everybody, the staff, the board. Kelly, you've been my right arm with all these programs, all these minutes here, and everything else like that. I mean, I'm not going to be verbose. You don't have to type so much this time, okay? Okay. Going on, we have consideration and possible action on proposed 2026 Health Department fees.
Right, so every year we bring the fees in front of you all, just to lay your eyes on them and give feedback. This is embedded in the city's processes as far as the budget and the finalization of that. This year, we did receive a recommendation from the finance department and from administration to do a 2% increase on the fees if we are able to. Sometimes we can't because of the state imposing certain restrictions on what we can and can't increase. But for these fees, we did increase 2%, except for the lodging fees. And Trista is here tonight to give more explanation, but the lodging fees have increased a bit more, and the reason why is because the state department, DATCAP, Department of Ag, Trade and Consumer Protection, is revising the code, the state code, and increasing the state fees pretty significantly, actually. And that will go into play, it will go into effect in 2026. We, at a local level, as agents of the state, pay a percentage back to the state for their administrative support to local agents. And this year, we paid back 12% on their old fee schedule. And next year, we are paying 13% on their new state schedule. So Trista and I sat down and we looked at the difference in dollars, and we had to increase the lodging fees for that difference. And so that you will see, especially in the motel, also the tourist rooming house, there was a significant increase. However, it's still lower than what the state is going to be charging. So I think the establishments will appreciate that fact that because we're an agent of the state, we had to increase it because we have to accommodate for that payback to the state, but our fees are less expensive than the state fees that are going to be enacted in 2026. And I'll stop there. Trista, I don't know if you have any additions to what I had.
I thought it was a very good summary.
Okay. Or if anyone has questions.
Any questions? Trista, I do have a question. You had 43 tourist rooming home licenses this year already. Is that because of the draft? Or has the city of Pere always had approximately 43 tourist rooming homes licenses?
I think we were at like 20-some, like low 20s prior to the draft.
Mhm.
We got up to 59, and then at renewals this past summer, a few dropped off. So we still gained at least a good 20 to 30 of them just because of the draft, and then they kept on. So that's pretty great.
Thank you for answering that one. I said, no, 43 sounds like quite a few for the city to Pere, I think, but I think some of it was because of the draft. Also, the other question I had, I didn't realize we had 8 tattoo parlors in the Pere.
We added 3 within like a month's time because there's a new facility that was the former Mac Dental building, and they're utilizing that for body art. So they're individual practitioners in each room. Great use of space.
And then my last question is weights and measures. Has there been any increase in terms of fees, percentage that we give with them?
That's
No
a
increase.
And that's a good question. That actually is one of those things where we have to be sure that we're not making more than, our expenses are for that program. And that we couldn't raise those fees because of that we're just in line there.
Okay. And then, Crystal, you had some general public health programs as well that you're raising basically $1, it looks like, and $1 for here, but that's insignificant, really.
Yeah, and there are many things on that general public health revenue that we don't currently do, but we have to put a placeholder in the event we do need to provide that service. One good example is the TB skin test. Right now, we're not doing those just because the demand, and then you open a vial of tuberculin solution and then you don't use that vial and it expires. So in the event, though, we have some sort of investigation that we need to complete, we would be able to start doing that again, and there would be a charge because we would need to order the solution and pay for that. But we do also have the TB skin testing on our standing order list that Dr. Shandell reviews. It's just that we're not providing that service right now because of low demand.
Okay. Can I hear a motion about the fees, to accept the fees as stated?
I'll make a motion.
Motion.
to approve.
A second?
I second.
Okay. Any discussion? Any further discussion? Hearing none, all in favor of the fees as provided to us, say aye.
Aye.
Any opposed? Okay, motion passes. Thank you, Crystal. And thank you, Trista, for being here and explaining some of the things as well. $13% now, eh? Wow.
Yeah, 13%.
Used to be 10% for a while, so.
Raises 1% every year.
Okay. Next item, Program Performance Management Dashboard,
Yeah,
third quarter.
Yep, thank you. We keep this as a standing agenda item. Again, that purpose of a performance management and quality improvement system is to provide a framework to guide program performance management. So we have those benchmarks, and if we're not meeting those benchmarks, we have to look and say why. Why are we not? Should we be doing something different? So we're in the third quarter right now, and as you can see, we've color-coded all of the benchmarks. I think the one that we should be concerned about is the flu vaccine being administered. Despite all of our best efforts in providing opportunities for people to be vaccinated, hopefully they're going elsewhere to their provider, Walgreens, CVS, pharmacies. And we're not sure. So we are providing our clinics like we always do. And this year, because of our low performance, and most of our numbers will come in Q4, but it has been lower than previous years. We are doing a pop-up clinic over at the food pantry to see so we're taking the mobile unit out there and doing a flu clinic out there to see if there's any we can provide. We also have some restrictions. I know that there's been requests to do Medicare population flu vaccine clinics, and we are not a Medicare provider, so we are unable to provide that service to that population. So there's a lot of things at play, and it's just something I think that when talking to other health departments, we're all experiencing this low uptake of influenza vaccine. But we're going to try a pop-up clinic over at the food pantry, and that is next week. We will be publicizing, we've actually already given some materials out to our partners to promote that clinic and trying to get people out to the mobile unit. We're going out in the field to try to bolster those numbers.
Are you able to, I know that if you give it, you have to put it in the state database, but there's not a way for you to track that to know how many De Pere residents have gotten it.
Yeah, and that's where we get our numbers and what we're seeing here. We will see data to know what the flu uptake is universally outside of, the ones who received it at our clinic, to your point. So eventually, after the season is over, we will be able to go into the Wisconsin Immunization Registry and see what the overall uptake is. And like I said, hopefully they're going to their providers, going to pharmacies to get the influenza vaccine. But so far, it's been lower than previous years. So, but yes, good point. We will be able to see that overall number from the Wisconsin Immunization Registry.
Crystal, you currently charge $25 for a flu vaccine. How does that compare to other health departments?
Actually, I do believe it's lower than what other charges are. We basically cover the cost of our vaccine and the supplies to give it. It does not take into account the salary it takes, to prepare clinics indirectly and even to administer. It doesn't include time. And so administration fees, we don't include that. So I do believe it's probably lower, but the thing is with a health department, especially one as small as ours, and I even think some of the larger health departments, we don't bill insurance.
Right.
And so, that's one extra step for people to have to do to submit, the receipt to their insurance to get reimbursed because we are just not set up to bill insurance.
And providers will bill the insurance.
Correct.
So
Correct. Yep. So yeah, good question.
you're good at bringing the information to the public so they know to get a flu vaccine. Do you tell them then if they call to try to schedule it, check with provider or CVS or Walgreens?
Yep.
Because you might be able to get it for free.
Yep, we do talk about that.
Okay.
Yeah, and we have had it. Right now, we're screening out for those who are eligible for our vaccine, right? So we can only give to people who don't have insurance, children who are on Medicaid, or adults who. We can't give it to adults who are on Medicaid, but we can give to adults who are uninsured. So there's a lot of algorithms we go through over the phone in getting them to the right place to get their vaccine. Kelly does a really good job at that doing that when she answers the phone. But yes, there are some people, just a handful, that still prefer to come to the health department and will take that extra step to submit their receipts to the insurance, but it's becoming few and far between. And we do want people to go to their primary care provider. That is important. That medical home is very important. And I think it's just more and more people have options in the community to get the vaccine, and that's good too. So like you said, that end of year seasonal report from the Wisconsin Immunization Registry will tell us the overall uptake, whether they got it from us or not.
Okay, any other discussion? Hearing none, do we need a motion with this or not? This is more or less just a discussion
Discussion,
item?
yeah.
Okay. Well, thank you very much. Looks like you've got another, well, I gotta say, you're halfway through the quarter. You have a month and a half left to complete everything, don't you?
Yeah, right. Couple yellows on there yet.
Okay.
We'll get it.
Communicable disease report, quarter 3.
Yes, this was prepared by Danielle. And actually, I will mention, you'll see here that, it's very consistent as previous quarters with chlamydia, the highest reported disease. Danielle is actually at Lambeau Field tonight, handing out condoms as a protection mechanism to reduce our chlamydia numbers. So she is out. She partners with Brown County Health Department and Oneida tribe to go out and do that together. But again, this is the highest reported disease, and thankfully, ever since we received access through agreement with the electronic health records, we're able to navigate those reports so much quicker. So that's been really helpful because that, requesting those medical records to close those reports seem to be so time intensive. So although it's the highest reported disease, I will say that having access to that electronic health record and that information allows us to close those cases out a lot sooner than we had in years past, and that's been really helpful. You'll see here she mentioned the nearby outbreak of measles. I think we did get up to 36 cases in the state of Wisconsin, but none in our jurisdiction. And so kudos to Oconto County that handled that outbreak marvelously and with the state support. We actually, and I think I mentioned this in previous health departments, we actually supported our partners by going and doing some fit testing out at a clinic to help protect the people doing the testing. So really, again, kudos to Oconto County for managing that outbreak and keeping the cases at bay.
I'm just saying, you took pictures of me getting awards. I think it would have been worth a picture of her handing out condoms at the football field.
Did you have to draw straws to see
That
who
would,
had
that
that
would
job?
really be an interesting one to have. Okay.
Yeah, and I think she also did in your packet. She is in that work group with Oneida, that comprehensive health division, and they had a brainstorming session on things that they could do together to kind of tackle that incidence of STI not only in our jurisdiction but in everyone's jurisdiction. So she did include that in your packet for you to look at. It was kind of a neat thing.
Yeah.
How they brainstormed together and then came up with that meaningful mark, it's called.
Cool.
Any other questions about the communicable disease report? Okay, hearing none. Next item is the environmental health quarter 3 report.
And Trista put this together. Trista, if you want to come up to the table, you are more than welcome to speak to the report. She did a great job summarizing this last quarter. And she mentioned too in her report that lodging code, that ATCP 72. And so if you have any questions for Trista, she's been doing such a great job at getting to all the inspections and just really having nice rapport with our establishments and really appreciate that relationship. In fact, last weekend, she partnered with one of our establishments and did a really nice event for the community. Trista, I'm going to turn it over to you.
Okay.
You can talk about the event last weekend. You can talk about anything here.
Yeah, so for the last 2 years, this being the third year, we partnered with Festival Foods to do a Let's Talk Turkey holiday food safety event to promote education in the community and get some resources to the people that maybe don't have a food thermometer at home or don't know what cook temps are. So we had those resources available, and we're giving them out to people that were willing to take them. And it's really great to partner with Festival because I think it's good for the community to see that regulatory and industry can work together because we all have the same goal. So that was good, and I think we're going to continue to do that moving forward, but maybe with some logistic changes so that we can have better reach with the lot. I think, if you do shop at Festival, a lot of like the Boy Scouts and Girl Scouts are in the vestibule on your way out, and they're selling stuff, and that's where we were. So a lot of people were kind of like just cruising on right by, like, huh. So we'll make some changes and have a more successful event moving forward.
Because we weren't selling anything at all. In fact, we were giving away free food thermometers.
Yeah. And Festival generously was raffling a $50 festival gift card. And the odds were really, really good because there wasn't a lot of people that stopped to put their name in.
Just I'm interested in the new code enforcement specialist. That's somebody else that's been hired from the city, and you're going to be working with them to have them do weights and measures?
Yes. So Development Services has the code enforcement specialist. He basically does just that, doing enforcement for code violations around the city. And one of the job duties is to assist with weights and measures. And his name's Chris. He's been very receptive to any training that's come up or shadowing me for a day on different weights and measures activities. So that's been really good. And we've been able to basically coordinate it so that he will help take over doing gas pumps, which is a pretty sizable time commitment. So he'll be going through training, and I'll be getting our software inspection program cleaned up so we can get him on board with that. And we're working with IT to figure out some of the issues with how to use that program because it's only been just one person in the past. So we're not used to having two people in that program. But I'm really excited to have more time to focus on some of the agent program stuff.
Yes, that was very generous and kind of Developmental Services to provide that support, and especially related to the gas pumps, because that is a very physical job, even with all of our protective equipment and our, what would you say, ergonomic changes that have been made and invested in, so that support will be really helpful, not only with time, but also the physical component of that job. So again, commend Developmental Services, Dan and Chris and Dennis, for their willingness to be able to support Trista in that. So.
Any other questions for Trista while she's here? Hearing none. Thank you very much, Trista, for explaining
welcome.
the environmental report and what it consists of. So thank you. Okay. I have to ask you a question.
Yeah.
What is this?
Right, I know. Yeah, that was,
seen it. Yeah, I
that
know
went
you've
with
seen it.
that communicable disease report. And that was something that Oneida Comprehensive Health Division sponsored, that strategic planning session to try to reduce the STI incidents in our community. So that was their art. Their meaningful marks is captured.
I don't know if anybody else had questions on that. I looked at it and I said, this is the first time we've had something like this in our minutes for quite a while, I guess. So, okay.
Like brainstorming for
Yeah.
me.
Yeah.
Yep.
So I knew
Yeah.
exactly what you were
Yes.
saying.
I
Yeah.
was expecting the yellow brick road to come around here somewhere and trace where it ended at, I guess. or
Creative.
something.
Instead of yellow stickies.
Right, yeah, right. Danielle said it was amazing how they were doing that while they were talking.
It's pretty cool.
Capturing what they were saying.
It's
Looks like the way
amazing.
you traveled, Dennis.
It's amazing just looking at it, trying to figure it out, I guess, sometimes. So anyway. Director's Quarter 3 report.
Yep. as the standard agenda item, thank you. Just highlighting things that have occurred since our last meeting that really don't make the performance dashboard or other efforts, so or other reports that are provided. So really highlighting the injury prevention events this summer. We did a lot of bike helmet distribution, and so wanted to highlight that. Over 250 helmets. Thank you, Mayor.
How do I send it?
Really the uptake of immunization we talked about, but I wanted to really detail out the things that we're trying to do to increase our uptake. And then social connectedness. Now, we have finished some of our programming. We still have yet our senior ball on November 20th, and we're trying to get the word out. This is that intergenerational dance that is happening at SNC, St. Norbert College, connecting our college students with our older adults. So far we have 14 people registered. So if you could spread the word on that, that would be super helpful. That's happening next week.
Next week, next
14 students? Or
We have 2 students and we have 12 older adults. So, and we know that the students will sign up, but probably not until the week of, we're guessing. But we're working with Aaron Bonchers over at St. Norbert College to really incentivize those students to participate, and we're really excited for it. So we'll have a follow-up on that when we meet next. Mental health first aid, Danielle had worked with our community partners and doing that event or that program, that certification at no charge. Sarah has been working diligently and also Kelly receiving milk donations. We are a milk depot, and we have collected 39 gallons of breast milk and getting it to that center in Illinois to process and pasteurize. So what a great thing since May of 2025. Yes. General grant updates, just wanted to give you all highlights there. At first, we thought we were going to receive a 28% reduction in preparedness grant funding, but just yesterday, we received our contract that made that full. And so we are level funded for preparedness. And then 2 contracts we're still waiting for is maternal child health, which we actually saw a pretty significant increase, 33%. And I think part of that is because we went to a level 3 health department. I think they rely heavily on that in their formula. And I'm looking at Chris to correct me if I'm wrong. But I do think that that has been, we just haven't received the contract yet, and grant, the lead grant is expected to remain level, and we haven't received that grant contract yet. So usually in February, I'll come to you as part of the agenda with those final numbers as soon as we get the contracts. Strategic plan update, just so you know, that is continuing. We're working with Kim Whitmore. Thank you to Terry, who has participated in that. We are at the point of developing objectives within that strategic plan. And once that's finalized, I will be sure to share it on this meeting agenda and kind of walk through that with you. And again, thank you to Terry and City Administration who are able to participate. WALDAB, I know Terry, you had requested having that update. So Wisconsin DHS is offering one-time funding, $400,000 to regions, not local health departments, but regions, to support a shared service model focused on access to care. And so a lot of our WALDAB time is planning and preparing for that. And our next meeting is Thursday. And I know I sent you all the agenda. I do that every time. If there's any interest or you want to click in virtually, you're always more than welcome to. But anyway, back to that $400,000. So the fiscal agent has been chosen. It is Winnebago County. But we're not quite sure what project we're going to choose yet. We have about 5 in the mix right now. One of those being a closed loop referral platform hosted by the United Way. We're going to learn more about that at our next meeting. And we will have a visit from Paula Tran, the state health officer, as well as Jennifer Rombowski. Do I say that right? And she is Chris's supervisor. So they will be at Thursday's meeting, just checking in and talking about any issues with the health officers that come up. So that will be our next meeting on Thursday. And then finally, seasonal intern Katie has now moved on, rode off into the sunset, and has landed her full-time job. And we're so grateful for her time and all the support that she has provided our health department. She, again, I'll always say this, was our first and probably last epidemiologist at De Pere Health Department.
Very cool.
But it was really neat having her, and we still get to see her, not we, but Danielle, because she goes to one of the same meetings that Danielle goes to. So it's kind of nice that we still get to see her in her professional role.
Where is she now?
She is at Aurora.
Oh,
Yes, providing services. And actually with communicable disease reporting and
cool.
in that department. So it's kind of neat that she saw both sides of that function. So yeah, Katie Weisner is has completed her time with us. And then Trista talked about Let's Talk Turkey, and I just included that in here. And that wraps up the director's
very
report.
cool.
I have just one question, I guess, with the WADOB update. Is it every region's getting 400,000, or is that $400,000 spread throughout the state?
Yeah, every region
Every region.
is getting 400,000.
Chris, where'd they get the money from that from?
Public health infrastructure grant.
Really?
From, where did, like a federal grant or?
Wisconsin applied for, I don't know how many states got it. I want to say 12, I could be wrong on that number, I'd have to look that up. But it's basically, it's allowed our department to, certain amount of the money goes towards local efforts, but then we've also added some staff that we wouldn't have. And so that's also where I've used some of the dollars for welcome to leadership orientation, or we're doing a deputy health officer orientation. So that funding goes another 2 years, and then we'll have to see, does it get reallocated, what happens, or we're gonna have some challenges that.
Where did the grant come from?
I wanna say, I don't know if it's CDC, I don't know the funding source. per se.
Wow.
There's other people that are fiscal people that, I know I've used the money, I don't know.
But it is pass-through money.
It is passed.
Okay.
Yeah, yeah. And we, as a local health department, have a FIG public health infrastructure grant as well. And that is what is funding our strategic planning, our intern, like Katie, our intern time, and things that we haven't decided yet. But like Chris said, we have until 2027 to figure out the best ways to use that funding. Again, we can't use it to hire full-time staff because the funding will be going away. So that's always the hard balance. So how can we build our infrastructure without funding full-time staff?
It's nice to know where the grant fund comes from, because I know with ADRC, they let us know who's funding our grants, and then we can write thank you letters or acknowledge them. So, and that's good, to let like employees know too. So
Yeah.
just.
$400,000 is a lot of money
It is,
to spread
yeah.
throughout 17 counties, so it's gonna be quite interesting to see how that pans out.
Yeah, and
Yeah.
how it's used. That would be
Right.
good to get updates on how it is used and what
Sure.
the impact on, how much it impacts you.
Yes, I will keep that as part of the WellDAP update
Okay.
that I keep in the director's report.
Any other questions with the director's report?
The senior ball ticket isn't working.
It's not working.
Like if I go to get a senior ball ticket, it says it's unavailable.
Ooh, well, that probably is
Ah.
part of the problem. We'll check into that. We will check into that.
Where was the link?
It's just on the
On the
social
website.
connectedness.
Huh.
Yeah. Yeah.
I just Googled the senior ball
Oh,
in
okay.
De Pere.
Nice. Thank you for that catch.
Yeah.
Kelly's on it. Look at her. She is. She is like. I did look at the job form today. It is the job form's working, so it may just be that link on our website. But thank you for catching that. We're on it.
You're not 55.
No, but I wanted to see like what it is.
Yeah.
Yeah, no, I
If I
got,
was
To
a
wait with
student,
that,
I would be.
Apparently, I think I should, okay.
I got the same thing. And is there a poster that we can?
Yes.
Is
Yes.
it on the?
We'll be sure.
website?
We'll be sure to follow up and email you.
That'd be great.
Yeah.
Yeah, send
then I
pics.
can-
Should we send it to your Nicolay
Yeah.
email? Okay.
Yeah, De Pere Housing.
Okay.
Yeah, it's been on our Facebook page too,
Okay.
the poster.
That would be good to put it on, have a poster at ADRC as well.
Mm-hmm.
Cool.
Any other questions for the Crystal with the director's report?
Made a note of that, so
Okay.
I'll follow up.
That's probably
Thank
why you
you.
only have half a dozen people signed up so far, I guess,
The
whatever.
website
Yeah,
link.
you might get some more.
Yeah.
And it was just from our website that you were.
Yeah, it looks like I'm on the De Pere website.
It says social connected.
See from our Facebook.
Social connectedness on the dprwi.gov.
Well, it's grayed out here, like as if it's closed right now in our job form. So, can I go in and
You're
edit
gonna
it
have to figure that one out, Kelly.
and make sure the end date?
Yep.
While they're discussing that, any future agenda items?
It's disabled.
Okay, hearing none. Have a motion. Last time I'll say it, motion to adjourn.
I make a motion to adjourn.
Second,
I'll second.
all in favor, say aye.
Aye.
Opposed? Meeting is adjourned. Been a pleasure serving you.
Thank you.